We are excited today. As if you've joined us a couple of times, you'll notice we have a mix of our own faculty, other speakers from BYU whose work is interesting from an anthropological perspective, and outside speakers. And today we're excited to hear from one of our own. We're hearing from Dr. Greg Thompson. Dr. Thompson has been here at BYU since 2012 when he was in a visiting assistant professor position for 2 years, and since 2014 as an assistant professor. He got his PhD from the University of Chicago in the Department of Comparative Human Development in 2011, where he also did a master's degree. And just to give you all a little bit of context, we actually have three of our faculty who have hailed from that program, including myself and Dr. Charles Knuckles. And Greg is a genuinely interdisciplinary scholar. His work spans psychology, linguistics, human development, and of course, anthropology. Which is it really adds to the interdisciplinary fervor of our department. That's a good thing, by the way. He had a master's degree also from the University of Utah in education, culture, and society. So, of course, education is one of those disciplines where his work really permeates and penetrates. And his undergraduate degree was also from the University of Chicago in psychology. Um, his work spans a number of very interesting topics, and I think his talk today is just another example of the breadth of what good interdisciplinary a good interdisciplinary orientation of a scholar like Dr. Thompson results in. But just to give you a sense of some of his other work, he's co-edited an edited volume entitled Fashions of Speaking and Temporalities of Self-Fashioning in the journal Language and Communication. And his work deals with vision and speech. His dissertation was incredible. It was a microlinguistic analysis of the types of interactions that led to self-perceptions of students on the south side of Chicago of seeing themselves as good students versus bad students, and really sort of diving into the deep analysis of the microlinguistic interactions that lead to those types of subjective outcomes. So we're really excited to hear from Greg today, and I will turn it over to him for his talk, and I'll let you do your own title there, Dr. Thompson.
Great. Thank you very much for that kind introduction. It's always a little uncomfortable when you say nice things about me, Jacob. Uh,
And
so,
uncharacteristic as well, right?
yes, indeed. We like to argue a lot. So, let me just preface this by just saying that this is my first time giving this talk or presenting this in any fashion, whether written or orally. And so it's not as polished as I'd like it to be, but it is what it is, and best to get on with it. So my topic, of course, is culture and COVID in South Korea. Just kind of engaging with questions of what does culture have to do, what might culture have to do with the spread or relatively more limited spread of the coronavirus in South Korea. So we'll start by just laying out my two big arguments. The first one, for those who are anthropologists, you probably have already accepted this, but not everybody has. So I think it's worth stating that culture matters in the management of the COVID-19 pandemic. And I'm specifically making the case in the case of South Korea. The culture of South Korea has had a positive impact on limiting the spread of the coronavirus in South Korea. But I'll also say that for the anthropologists and for those maybe psychologists and social psychologists who are have sort of a superficial conception of culture, I want to push it a little bit farther and note that common ways of characterizing culture, in particular using that single term collectivism, are insufficient for understanding the cultural processes at play. And what is needed is better ethnographic documentation of these processes as they happen in life. So the first argument we'll say is for a generalist audience, and the second argument is for a generalist audience, but also for those who are maybe accept the first claim. And the question is, well, now, so what do you have to add? So let's start with a sort of an overview of what COVID in South Korea has looked like. And then we'll do some comparisons with the US just to give you a sense of relative, I need some terms for this, infectivity, relative spread of the rates of infection, we'll just say that. So it started, it's actually only one day before the first case was reported in the US. The first case was reported in Korea on January 20th of 2020. Soon after that, there was an outbreak in Daegu, which is in sort of central South Korea. And it was first reported there on February 18th. Within 11 days, there were 2,000 confirmed cases. And just another week or so later, there were 5,000 confirmed cases. The result of that was on March 25th, Daegu had a voluntary lockdown. It was the people of the area were asked to self-quarantine, and it was highly effective and very closely followed. So that's one little bit to start to think about. So let's look at some comparisons of the data, of the numbers of South Korea as compared with the US. We'll look at total cases, total deaths, cases per day across time, and deaths per day across time. And then also testing, just to get a look at what testing has been like in the two countries. I will note these are all scaled for population. So we don't want to, if we want to make a sensible comparison, we want to make sure that we're not comparing just sheer total number of cases in the US versus South Korea, because the US has about 330 million people, South Korea has about 51 million people. So that wouldn't be a fair comparison. So you'll notice all these numbers are per million or per 100,000. So they give an apples to apples comparison. So here's a look at confirmed cases per day, and you'll see, I think those living in the United States can be happy about what you see on that top red line. And I suppose that the recent snowstorms probably have helped to contribute to keeping people indoors and limiting spread, but there's other things involved there as well, since it looks like it's about January 10th is when you start to see this nice downward, very steep downward line in the United States. But overall, you can see that when comparing that bottom line, yes, that thing you can barely see is cases in South Korea. And again, this is scaled, so this is per million people. And so what we see here, and then we can see deaths. Also, initially I pulled the data about 4 days ago, and we still hadn't quite seen the turn at that point, but now we're starting to see this nice downward trend in the US. But comparing overall, you can see there's a pretty substantial difference in terms of the total numbers. And what this has basically been, I'll give you, this next slide will give you cumulative cases and cumulative deaths in the two places, so you can compare overall what does it look like in these two places. And you can see it's essentially, if I had the numbers there, you could see it's essentially about a factor of 50. The US is on the left and South Korea is on the right. So essentially what this means is you are 50 times more likely to get infected with COVID in the US as compared to South Korea, about 50 times more likely to die of COVID in the US as compared to South Korea. So you can see my point here is simply that there's a dramatic difference. There's something that South Korea has been doing that has led to really remarkable ability to contain and limit the spread of the virus. So that's sort of setting up the big question here. One possible answer to this might be, well, testing, and this was something early on that people were talking a lot about. I know I was, is testing in South Korea is so much higher than it is in the US. And you can see here, initially it was, but by the middle of March, really, the US had, and this is tests per thousand again, so it's scaled to be apples to apples comparison. But by mid-March, the US had exceeded the tests of South Korea. Now, you can always, there are other ways to ask this question and say, well, have we done enough testing given the how widespread the virus is? Shouldn't our testing be 50 times that of Korea? And you can see it's not. You know, if you pick a number over here of maybe at about where it's about one, so it's about a 1 to 5 ratio. So there, other places it's probably more like 1 to 20, 1 to 10, 1 to 20. But you would expect it to be a 1 to 50 ratio if it was comparable based on that. But nonetheless, the important point takeaway here is that you see that the U.S. actually exceeded Korea in terms of testing per 1,000 people, starting back in mid-March. Okay, so that's to say, it seems unlikely that testing would be a sole explanation. Some other things to take into account is that by some estimates, 90% of South Koreans live in an urban area, in a densely populated urban area. So South Korea has, not only did they have an early outbreak, but they have a very dense population, which means that you would expect that it should be more easily transmitted and more commonly, more frequently transmitted than in the US. And yet we see the exact opposite. This is just a comparison of major cities, and this is in terms of sheer population. And you can see that Korea's top 6 cities compare pretty evenly with the top 6 cities, the population of the top 6 cities in the US. And that's in spite of the fact that Korea is almost a seventh the size of the United States. So it's people are packed into cities, very densely populated country compared to the United States. And so that's something that you would expect to push the other direction, right? You would expect to see more cases as a result of that. So here are just a list of some measures that have been taken to combat the spread of coronavirus. Mask wearing is required on public transportation. There are substantial fines for this. There's contact tracing using cell phones. So when somebody is diagnosed, then their cell phone information is used to inform other people where they were without using names. There's no, it's all anonymized. But this means if you're in a particular area where somebody has been that has had the coronavirus, if they went to a cafe, for example, there'll be a text that will pop up on your phone that will say, confirmed coronavirus case was at this cafe on this day. And then you think to yourself, well, and then it'll also say, if you were there, then you need to get tested, right? And so you think to yourself, where was I on that day? Was I at that cafe? Is it possible that I came into contact with this person? Really, really powerful tool, but it requires that people give that information, right? They have quarantining of all people entering the country. This has been since sometime around May, I think, is when they started doing this. I have a student that got there just before and a student that got there just after it. The latter had to quarantine for 2 weeks. It's closely monitored. Your cell phones are tracked, and there are major fines also for this for non-compliance. They did have early testing. There's another possible explanation. But as I pointed out, the US soon surpassed South Korea in terms of testing per 1,000. Work from home is something that's been implemented widely, and this is in spite of the importance of person-to-person relationships at work. So hanging out after work, going out to meal, drinking with work colleagues is a big part of work life in South Korea. And so this has affected that rather substantially, and yet it seems to have uh, been followed fairly closely. Um, there's also, well, I'll mention this next one in my next slide. So some explanations for South Korea's relative success is there was an outbreak in 2015 of the Middle East respiratory syndrome that was very serious and led to less than 100 deaths. I think there was, but there were less than 200 people that were infected. So it was a very deadly virus. And that kind of, that did get some of the institutional structures in place for dealing with this. So, but I think, so as an explanation, I think that's useful, but it also only explains things in the early going, right? Once the United States, we had a month or two or three or four of this to see what's going on, you'd think we would be able to adapt and build up the necessary infrastructure. In a lot of ways, we did. But my point is that I don't think that experience necessarily can explain this massive difference. There were strong policy interventions that I mentioned some of them. That's another sort of explanation. But for that, I think there's still a question about how culture inflects these kinds of things, right? This is a big question. So you can put a $5,000 fine for not wearing a mask on public transit or even in public or in public buildings. You can do that, but whether or not people will accept it is a question. And in the United States, I think there's clearly not a political will for that. So I think you really need to start to pay attention to culture when you're asking what kinds of things is there political will for? Um, so strong policy interventions, yes, but there's also culture behind that. Socialized healthcare has been another one, but if you compare Korea to, if you compare Korea to other European countries that have universal access to healthcare, you don't see a huge difference. I mean, I'm sorry, you see a huge difference, right? European countries some are doing even more poorly than the United States in managing this. So universal access doesn't seem to be a fair explanation for, it might contribute to it to some extent to limiting the spread, but it clearly doesn't explain that difference. So the other way to go here are cultural explanations. And I think, of course, that's where I'm headed with this. I want to speak to this first one that kind of gets caught up with the second one. So collectivism is the big sort of explanation, and there are a bunch of articles out there already that are talking about collectivism and using various kinds of collectivism measures to show that collectivism correlate that countries that are more collectivist, right, are also have been better able to manage the coronavirus, the spread of coronavirus. The research is out there, but one of the things that often gets caught up in that is this idea of sort of a willingness to submit to authority or obedience. And I just want to make clear, well, I'll mention it on the next slide. I'll point to this issue in that bottom point. So collectivism, my response to that is sure, but it doesn't really tell us much about what things look like on the ground, right? Collectivist cultures include places as diverse as Korea, Kenya, Kazakhstan, Greece, and Guatemala, right? Dr. Hyungjin of Seoul National University has argued that even in regions that are as seemingly tight as East Asia, Japan, China, Korea, there are substantial differences in what collectivism looks like, even in those areas. So this is sort of a simple argument about collectivism is a very sort of rough and broad tool that doesn't give us a real sense for what does this look like on the ground? What are people doing? And related to that is this second point that perhaps collectivism could lead to higher rates of infection, right? Collectivism being people are more likely to feel the sense of a community and to feel the need to be with others. And so because of that, people are around each other a lot more. And you could have, you might predict from collectivism alone that you'd get increased likelihood of gatherings of groups and higher rates of infection. And one example of this is Orthodox Jews in London. It's been reported there's a 64% infection rate compared to London in general is 7% or something like that. So among Orthodox Jews in London, you get 64% infection rate because there's so much that they do together that has to be done together, that they're exposed to each other and end up passing, the virus spreads very rapidly. So another concern with collectivism is that this notion, this concept, particularly as it circulates in popular media and among lay people, oftentimes can carry ethnocentric biases, right? It's often thought of as a lack of individualism and autonomy, and it can lead individualistically minded lay people to conclude that people in collectivist cultures are teeming hordes of mindless drones that can't think for themselves, okay? That's probably overstating it. You wouldn't necessarily hear anybody on the street say that, but when you hear people talk about collectivism in the US, you oftentimes have this sense of that's not something that's desirable, right? And it's oftentimes also the case that people don't know exactly what it looks like, right? Going back to that first point, just collectivism sounds like this thing that, whether it's things that communists do or socialist countries do or something like that, that it sounds scary to a lot of people and problematic, right? And so providing some articulation of a different way of thinking about it is what I'd like to do, rather sort of, I'm not sure if it's a replacement for the concept of collectivism, or if it's a totally different thing altogether, but I'll be introducing this notion of social proprioception. In addition, collectivism, the concept as it's used is oftentimes just ignorant of history. So in the Korean context, there are a lot of people that will talk about trust in government, right? And this idea of sort of the Korean people just follow the leaders. They're going back to that last part, right? They don't really think for themselves. It's just that's what collectivism is. But if you are familiar with the past half century of Korean history, you'll know that this is absurdity, right? The past 60 years, Korean people have protested and ousted 3 dictators, 4 if you include the impeachment and ouster of Park Geun-hye in 2017. So this is not a place where people passively just listen to whatever the leader says. There is regular protest in South Korea, and active protests when something is put into place that people don't agree with. So that's important to keep in mind when thinking about the policies that have been put into place. It's not the policy that's doing the work, it's the political will behind the fact that people are supporting it. If they didn't, they'd take to the streets. And this is remarkable in Korea, is that there have not been mass protests about mask wearing, mask wearing being an infringement of liberties or something like that. And I have a slide later that has some brief interview responses to Koreans talking about these protests in the United States. All right, so the concept I want to introduce here is what I'm calling social proprioception. Okay, And this is what I'd like to, like I said, I'm still figuring out whether this is a replacement. It's a more granular way of thinking about collectivism, or if this is just, let's throw collectivism out the window and let's talk about something completely different. I'm still figuring that out. Maybe you can help me decide. But social proprioception refers to our ability to perceive our physical body. So we know the location of our hands and our nose, even when our eyes are closed, right? I can touch my finger to my nose because I can feel my body from the inside, as it were, right? Proprioception is that sense of feeling it. If you've ever read Oliver Sacks' book, The Man Who Mistook His Wife for a Hat, I think that's the one where he has a story about his own experience of losing his proprioception of his leg. He lost his sense of his leg being his, and he thought there was this thing in bed with him, that he was in the hospital for a brain injury, and he kept throwing his leg out of his bed only to realize that he was attached to it and proceeded to fall after it. So proprioception, it's something you can actually lose in certain with certain brain injuries and things, but it's our ability to feel our body and know in space where our body is. So social proprioception was first used by Clive Thompson, no relation to my knowledge, to refer to the weird, fascinating feats of coordination that can be produced among a group of people who are using social media. And his focus was Twitter. This is in 2007. And he also used it to sort of capture the way that we can feel social others' experiences through social media. So when we get these pings of updates of what somebody else is doing, we suddenly have this way of sort of feeling these social others in a way that without social media we just wouldn't have. We would much more easily maybe forget about them. But he's really limiting the concept to social media. So I want to expand that to refer to sort of something that goes beyond just social media. And in this context, it's part of, I'm making the case, it's part of Korean culture. And social proprioception is and can be defined as an awareness or sense of others who are a part of one's social body. So now it's not physical proprioception of your own body, it's this idea that we have a social body, a community of some sort, and we can feel or sense how other, and it's not, I'm not pushing any kind of supernatural feeling, but simply that it might simply be that we think of others, right? We think of somebody who's not present because they're part of our social body, right? We wonder how they might be doing on this day because we know that they're going into the hospital, right? So you can see how social media can produce that, but it can also be produced without social media, right? You just know, you remember that, you know, your boss is going in for surgery. Or, I mean, that one may be an obvious one, but maybe a friend is going in for surgery, or your child's friend is going in for surgery. That happens to be the case today. It's not limited to socially mediated experiences. Although I'd say the capacity is probably universal, right? This capacity for sensing others in our, whatever the in group is, right? And that can be defined in a lot of different ways, one's social body. So that's an important thing that I'll come back to with the Korean case, but it's differently developed in different cultures. So I'll give you just one example from a different culture, from Worora in Australia, to give you a feel for, because this is a really nice example that sort of, because it literally maps the body, the social body onto the body, so that one feels in one's body the one social relationship. It's a pretty cool example. This is Michael Silverstein's work looking at this group. So as he describes it, kinship is experienced not only on the body through a system of gestures, but as well as in the body, that is through feelings in the musculature. Hence kinship, one's parents, etc., is as well experienced parenterally. Okay, and parenterally means that it's experienced inside the body. Yes, Silverstein likes the language play, of course. And he writes, people interrupted, when he's talking to people, they would often interrupt conversation with him to remark on these momentary indexical body amulets, as we might term them, for the communicatively channeling the forces of a social universe, convinced that their own bodily state was an instrument responsive to the social consubstantiality of consanguineal kinship. Always a mouthful, to quote Silverstein. So here's what it looks like. These are pictures actually from an Anglican missionary in 1941 who is taking pictures of people pointing to different parts of their body that have correspondences with different different relationships, and some of them are somewhat obvious. I'll give you a quick. Well, let me. I wrote something up to try and read through this. Um, uh, and he discovered this when he was eliciting terms for body parts and found that people often offered kinship terms in conjunction with the terms for body parts. So thus, if I were, and you do this when you do introductions, if you introduce somebody, then you'll point to the appropriate corresponding body part. So if I were to introduce my wife's mother's brother, I would name the relationship and I'd point to my shoulder blade as I made this introduction. Interestingly, of course, this is a taboo relationship, somebody with whom I wouldn't have direct conversation because of the nature of the relationship. So look at where it's located, sort of giving the cold shoulder, right, back in the back of my shoulder blade. Similarly, when introducing my wife, I would name the relationship this time, and I'd point to my hip. Sorry, I can't get my hip in the screen. I'd point to my hip as I was introducing who it was. So crucially, these bodily sensations experienced parenterally, that is inside one's body, are indicative of something about that relationship. So that then a twitching in one's hip joint would alert me to some plight of my wife, a cramp in my right calf to distress for my classificatory brother. Shoulder pain on the front side might indicate something bad to do. I'm sorry, on the back would be something bad to do with wife's mother's brother. So you can see I use this as an example for this just beautiful poetics of proprioception, in which the physical propriocepts, joint pain, and just the physical body are mapped onto social propriocepts. I feel this, it means there must be something to do with this person, something going on with this person where I can feel that person, such that when one feels pain in one's own body, it is presumed to indicate some kind of pain in the social body of which it is part. In other words, this offers us kind of a full tilt poetics of what social proprioception could be. And it's really illustrative of what I mean by the concept of social proprioception. But just to be clear, this full tilt version of social proprioception is not what's happening in Korean culture. I really want to use it just as an example. So let's turn to what it is that we see in Korean culture. How does social proprioception get socialized, right? Kids have to be socialized into this kind of thing. And how does it get perpetuated? How is it reproduced in subsequent generations so that you have this thing? Well, a bunch of things that I'll point to here are these concepts, these cultural concepts that are oftentimes noted as being difficult to translate into English. There's even a book out by Uni Hong, The Power of Nunchi, on the first one. And it ties and connects to the other concepts down below. But Nunchi is really simply it's really poorly translated as empathy, but it has to do with an ability to read others and to read a situation. And that's where bunwigi comes in, that second term. Bunwigi describes the social atmosphere, right? So it's like you come into a room and you want to assess the bunwigi of the room, like what's going on here. If you have good nunchi, and we'll talk about the different kinds of nunchi that that exist, and the different character of the term, the way it's used in language and sentences. Um, so you do Nunchi to sort of get a sense for what's going on, and it's a way of attending to somebody else and their needs and wants, right? And it's not something one does always, and it's oftentimes something that one has an obligation to do when one is dealing with a social superior, somebody who's older, older brother, the generic older brother, whether actual or not, boss, teacher, professors, um, uh, people in command in the military. These are all people that one is expected to do nunchi to. And so you'll hear a superior say to a subordinate, uh, do I have to tell you what you need to do? Right? That's a big insult. That means that you are not properly doing nunchi and not paying attention. You're not anticipating what things that this person is expecting of you. So it's in these sort of formal situations, but it's also in less formal situations. One will do nunchi to friends, for example. Relationships, I've heard people say that particularly men say that in relationships, in dating was where they first learned the importance of nunchi. This is a way to show that you're attending to this other person, right? And Budam, I'm going to kind of, I think I may pull that one. It's more of a broader obligation that comes. It's more limited to hierarchical situations, and it's the it can be the weight of obligation, but one pursues it anyways. Bunwigi, as I mentioned, is social atmosphere. Sort of, you could call it the mood of a room, but it's really about the social context of what's happening here. What are the relationships between different people? Who's angry with whom? You know, you want to assess these things so you know. And then to have good nunchi or have quick nunchi is to know how to act, right? To have sensa, which is sense, the English word that's Koreanized, to have sensa. So along with this there's a sense of mutuality of being that is very prevalent in Korean culture and is captured in this term uri, which is simply translated as we, but it's really, what's important is how it gets used. It's really commonly used to refer to all kinds of different things, but it'll be used, if I'm talking about my house, I won't say my house, I'll say our house, right? If I'm talking about my wife, I won't say my wife, I'd say our wife, right? So you get this sense, uri becomes this, there's this our, this we-ness that's always present, right? And it also connects with the ethno-nation, right? The we-ness of Korea and Korean culture, of Korean people, that has at least a very strong recent history on the Korean Peninsula of the importance of who we are, and the need to sort of look out for the fellow participants of the we. Jong is a more restricted group. It's the group of sort of those people that I care about. It's often translated as love, but not necessarily romantic, but it involves some kind of giving relationship. I have Jong. When I went to one of the schools where in Korea where I would go and visit and hang out in classrooms from time to time in elementary school. I picked up some plums along the way because I knew this is one of the things you're supposed to do. And one of the teachers, when I brought them into the teacher's lounge and started to wash them and stuff, one of the teachers said, "Ah, you have Jung," right? She was very surprised that it seemed that an American would have the sense to do this. And of course, the only reason I knew is because I had been told by other people. But this kind of giving without expectation of return, perhaps something like that, is one way of thinking of what Jong is. And you can talk about, some authors will talk about a Jong space, right? What is the space of people that you have this sentiment with? And it's a sort of a tighter in group from the broader Uri, right? So just to give you a couple examples here, I see I have about 7 or so minutes left. Um, a couple of examples of what social proprioception looks like. And um, I'll give you two examples of sort of fails where, and I've done this myself. So I just realized I gave an example of me succeeding, and I'm going to give you some examples of my students failing. Uh, but these are two examples from our field school where we had students doing homestays, which are very difficult things to arrange in Korea because you're really in people's space in a way that obligates you to be in their jung space. And if you're sort of have the typical American attitude, which is, oh, I'm paying rent and I just am in this space and I'll stay out of the way and do my own thing, then you really miss it. And so there are these two examples. I think I'll start with the second one, which is I had we decided that the families wouldn't, that are the homestay families wouldn't be providing food for the people staying there because we had done that the previous time and it got a little bit complicated and messy. And so instead, the students were supposed to eat on their own. But we had a student who had a couple peculiar, sort of very American things. One was she would eat just like spaghetti, right? And that was all she would eat half the time. And this made her family very anxious for her. They were afraid she was malnourished. And in addition to that, she would eat at different times. So that would mean that she would not be eating when they're eating. But she would be hanging around in the kitchen or sort of, walking around because this is the place that she's renting a room in. So she feels perfectly fine moving around. It seems like a fairly normal thing to do. But of course, when they're sitting there eating and there's a person there who's not eating, who their sense is that this person is malnourished, their response is, come join us, right? They would feel terrible if they did not feed this poor malnourished college student who is living with them. So they kept insisting that she eat with them. And I kept telling her that she's not supposed to be eating with them. But we never quite put it all together to where we realized the problem was that she's hanging around in the space at the time when eating is happening. The way to fix that would have been to have her not be in the space at that time. Which is a difficult thing to do. And actually that helps me understand in the previous year, one of the families would just basically lock out the student until like 9 o'clock at night. She couldn't get into her her homestay apartment. Anyways, you can see these are complicated matters, much more so than you'd ever think when you're setting up a field school. And the first one was related to this or similar kind of situation where if you have Jung with people, if you have this feeling, then they should be on your mind, right? They should be on your mind. So when you go on vacation and they're not on vacation, that should be something that's kind of, nagging at you a little bit. And everywhere you go, you should be thinking about, oh, my homestay family, yeah, they're not here with me. That's kind of sad. What can I do? Can I? And the idea is, you'd get them something. You'd get them a gift of some kind. It can be a fairly small gift, but just something that says, yeah, I was on vacation and maybe I had a good time. You wouldn't say that when you're sharing with somebody who didn't have the experience, right? You wouldn't want to. You certainly wouldn't want to overplay it. But maybe I had a good time, but I thought about you, right? That's the message. And we had this was a situation as well where the homestay families, and of course, all this comes back channel through me because the homestay families aren't telling the students directly because that would be rude. Um, Okay, so let's dig down a little. So that's the broad idea of social proprioception. Like you should be feeling other people in your space. You should be, and this extends further with the Uri concept to feeling people in the sort of the broader nation and other people around. But sticking to Nunchi and nuancing a little bit, there are these three different kinds of ways of talking about Nunchi. One is having Nunchi, Nunchi Ita and Nunchi Oppa. And then, of course, the quick Nunchi is Nunchi paroda, and that's if you're really good at doing, and you're good at responding to situations, right? Not only can you read the situation, but you know what you need to do to act in it. Feeling nunchi is actually a bad thing. It's when you're in a situation and you've done something wrong and you start feeling nunchi. Giving nunchi is what you do to somebody when they've done something wrong and you need to indicate to them that they've made a mistake. So these are all aspects of this capacity that one needs to have in Korean culture to be a competent participant of social proprioception. And I'll give maybe one example, and then maybe I'll just throw up the other examples. This is one. My wife is Korean and has good nunchi instincts. And one time we were at a bingsu shop, which is shaved ice, or it's actually frozen milk, shaved ice, frozen milk with all kinds of goodies on top. It's absolutely delicious. Not things you want to talk about at lunchtime, but we were there with our kids, and she was probably 12 at the time. 12-year-old daughter was sitting there, and she had a hat on. And there were some girls at the table that were next table that were kind of her age, and they kept looking at her and kind of laughing, like there was something going on. I'm not sure what they were laughing at, whether it was her hat or her clothes or something, but there was something they were laughing at, and it was kind of getting rude. And so my daughter kept mentioning it to my wife, and my wife gave them a look. Right, this is what you do: is you give a look. And that is a way of indicating, of trying to give somebody nunchi. This is the giving of nunchi. And she gave them a look, and they kept doing it. I don't know if they didn't see her or what, but she then proceeded to get up, walk around our table, and walk over to the direction to where she would get some napkins. And she gave just a little brisk bump of one of the girls' chair as she walked past. And I was shocked at how quickly this girl responded. She immediately sat straight up and kind of gave, and her friend just stopped talking completely. It was an immediate reaction. It was not, I'm angry at you for bumping my chair. It was, okay, I got it. I have, they felt nunchi, right? They had been given nunchi because they didn't seem to have nunchi, and they had been given nunchi, and then they felt it. Here's another example. Maybe I'll go, if I can run maybe 3 minutes long here, here's another example of one of my research assistants. Thanks, Louis Yu, for this little field note. I'll just read it quickly. I went to see a movie with a friend at a local movie theater. I was enjoying the movie, but about halfway through, I heard someone giggling from my right. Looked over and saw a couple sitting about 2 seats back on my right and talking and giggling. I ignored them, hoping it would quiet down. It didn't happen. They continued to talk and giggle as the movie was reaching its climax. I tried to concentrate. However, I got extremely distracted by the couple and felt like I missed the highlight and got a little upset. I stared directly at them, giving them negative nunchi in hopes that they would notice and be quiet. The guy didn't seem to notice, but the girl almost immediately took notice. She glimpsed at me for a half second, stopped giggling, lightly hit her boyfriend with her elbow, whispered something in her boyfriend's ear, and then he stopped giggling and sat up straight, right? These are always sort of indications. Yeah, okay, I know I've done something wrong. I didn't hear anything after that and enjoyed the rest of the movie. That was in July. Here's another one walking down an alley, also from Lewis. I was on my way home after meeting a friend. I decided to not take the usual route and take a shortcut instead. The shortcut involved passing through an old narrow street. As I walked by, I saw another man walking toward me. He was tall and seemed to be in his early 50s. He caught my attention because I noticed he was wearing his mask on his chin. I stared at him, and by the time we were about 10 feet away, he noticed me. We made eye contact for about half a second, then he immediately fixed his mask. He then avoided eye contact, but I could tell he was still seeing nunchi or feeling nunchi because of this awkwardness. For example, his back was straighter than before we had made eye contact, and although he was looking straight ahead, his eyes didn't really have focus. Other subtle clues included suddenly clearing his throat and putting his hands in his pocket, right? The whole situation, these things are incredibly subtle and quick. It happened for about 2 seconds, and that was January 9th of 2021. So I'll skip this one, but this is a few interviews that sort of ask people about mask protests, and then ask people about an image of somebody not wearing a mask on a Seoul subway, and people, feeling like this is really disturbing. So the summary here, this is my last slide here, and you can see it's still a little bit, I don't have a nice tight conclusion of it yet, but my summary is making the case that this concept of social proprioception provides a built-in public enforcement of COVID mitigation measures, such as mask wearing and social distancing. So this whole Nunchi process is something that can operate in public as a way of encouraging anybody who's not wearing a mask, people that aren't properly social distancing, as well as the broader concept of social proprioception, particularly when applied to the uri, the we of the nation, sort of provides a basis for making it a reasonable thing to institute public policy measures that can seem rather excessively punitive, maybe some people in the US would say. So that's the second point of the cultivation of social proprioception leads to support for these policies to protect the uri of the nation and those people with whom one has jong. All right, I'll end it there. Thank you all for listening.